Hey friends, in today's video, we are going to talk about two medical conditions in pets that could be an emergency that you need to know about, whether you are a pet groomer, a pet professional, or an owner. This is something that I had absolutely no idea about until it happened to me and one of my clients. Welcome back to my channel. If you are new, my name is Savana. I am the owner and operator of Pause and Relax, mobile pet grooming, and Reiki services. Today, we're diving into two different conditions that can be a bit tricky to spot, but it is crucial for every pet professional and owner to understand. Now, before I actually get into these conditions and my experience, what I went through with one of them, I want to very clearly state that I am not a vet and that this is not veterinary advice. Please consult a veterinarian for any health concerns regarding your pet. This video is based on my experience and my opinions. Let me introduce you to Casey, who you've probably already seen on the screen, and her story. Sadly, she has since passed away, but I am very lucky to still have these clips of me grooming her, and I also have the permission from her mom to share text messages between her mom and I, and also details and these grooming clips. So right now, I am going to be explaining exactly what happened with me and Casey and how I got exposed to one of these conditions. The other one is very similar to the condition that she ended up having. So I want to talk about both today because they're both very intertwined and one is an extreme emergency situation. Honestly, the day that this happened, it was like any other day I was grooming Casey. She is a schnoodle, so a schnauzer poodle cross. She didn't seem off. I groomed her about every 8 weeks. She had a specific cut in the summer, a specific cut in the winter. And yeah, everything was going normal. I started off with nails, then got her into the tub, washed her as usual, used her usual shampoo, got her on the table, got her fully dried, brushed out, and then I proceeded to start with the haircut. So normally I start with like paw pads with a 30, and then I will do a sani with a 7. So I lifted up her back leg to do her sanitary trim, and I noticed these marks on her stomach. Now, luckily, I have pictures of this as well, but I noticed these weird looking marks that I had never seen before. It kind of looked like a bruise, but I didn't know. And this was very unlike her. Her skin was always very clear, never seen anything like this. Instantly, I start panicking, thinking it's something that I did that was wrong, wondering if perhaps she had some sort of allergic reaction to the shampoo I used, except it made no sense to me because I used the same shampoo that I always did on her. No new conditioners, no new sprays, the same thing I always have for literally years. The only thing that was different that day that had absolutely nothing to do with the grooming process was that normally when I go to groom Casey, her mom is home. But this day, her mom was away and her dad was there. So that was literally the only difference. If you happen to just be passively listening to this video and not actually watching, this is the point in the video where I'm going to share screenshots of the conversation between her mom and I, and also the photos. So the first message I sent her was, "Have you noticed red dots on her skin? I took some pictures I can send you." Her mom says, "Sure, send them. Do you think it could be bug bites?" And this is dated July 29th, 9:22 a.m. I responded, "I first noticed them when shaving her sanitary. Then as I'm shaving, she has them elsewhere as well." So you can see that I have like one half of her sanitary shaved and the other half is still pretty furry. And you can see that there's like small kind of like red marks in her groin type of area. So then I sent a picture of a similar looking mark that's larger on her back because by this point I moved away from her sanitary. I was like, if it's something that I'm doing or did, I'm not going to work on that area anymore. So I started working on the rest of her body. And she says, "Please show Murray," which is her husband, "when you take her in. Do you think they are bug bites or an allergic reaction to something?" And honestly, at this point, I had absolutely no idea. I had never seen anything like this before. So I said, "It looks like irritation / a reaction as the ones on her groin are getting worse." Now, that should have been a red flag for me, but hindsight. Even on the side I haven't shaved yet. I said, I use the same shampoo I always do, so it can't be that. And I didn't look at her skin before I bathed her. And then I said, sorry if I'm bothering you, because I knew she was away. She said, no problem. I will contact our vet and see what she says. Then I said, I don't think I should shave her groin as I don't want to irritate it anymore. Then I said, here's a current picture if you want. They want you to email one in. She said, that's okay. Do the best you can. She has been licking down there a bit lately. I just thought she had pine sap stuck there and was cleaning herself. Then said maybe she had something going on and the grooming is just irritating it more. She has a few spots here and there on her body, but it's mainly in her groin. And then I said, just give Murray a heads up that I'll show him when I bring her in, and I'll take her groom slow to try to avoid any other irritation. She said, will do. Thanks, Savannah. And then I have a photo here where you can see it is looking a lot worse. Knowing now, this is actually bleeding and bruising, spreading underneath the skin. So I sent her that and I said, no problem. Here's what it looked like when I left, so you can have a reference if it's getting better. Let me know how she's doing or if you find out what it is. She responded, I can't remember if this was right away or not. She said, the vet thinks it's an allergy, probably to grass. I will keep you posted. I said, that sounds good. Thanks. At that point in time, I was like feeling very confused, but also like, I don't know, I felt a little less uneasy that maybe I had caused it. So then August 3rd, she texted me and said, hi, Savannah, just let you know, Casey's rash is disappearing. The vet thinks it was an allergic reaction to grass. I said, thank you so much for keeping me updated. Glad she was doing better. So then everything seemed to be fine. I went on mat leave, so she was seeing another groomer for a while, hadn't talked to them for a while. January 27th, I got a message when I messaged this client just to like see how things are going, kind of catch up with her, that sort of thing, because I hadn't been seeing her and her dog because I was on mat leave. I wasn't grooming any dogs. So her response to my message was, hi, Savannah, we are doing well. A lot has happened with Casey since you last saw her. Do you remember her having what we thought was a rash? Well, it turns out she has thrombocytopenia, but she is now in remission. But the meds to correct that led to ketoacidosis and diabetes. Other similar problems have come and go. She is now doing really well, but she is only about 2/3 of her weight now, and one drug caused her fur to thin. Her fur is slowly coming back. And then we start talking about other stuff. She's telling me about her cats, that I do her nails, and she's telling me how cute my kid is, blah, 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 blah. So that's everything that like pertains to this story. We now know that what Casey had was thrombocytopenia, which I will get to and talk about. But what condition I actually want to talk about first that is very closely related, something called DIC. And she told me about the thrombocytopenia. Instantly after this conversation, started Googling to get more info. And one of the videos I came across was a clip from the show Bondi Vet, which is a vet in Australia, I believe. This is on YouTube. I will either be putting in clips if I don't get demonetized, and or I will put a clip in the description box for you to watch the whole thing. I think it's like an 8-minute clip where you can watch the dog's full story. And he treated a poodle with the exact same symptoms. This poodle went into the groomers. They started shaving it. So once again, Casey was a poodle schnauzer, and this was, I believe, a full-bred mini poodle. They started shaving it, and they noticed the bleeding, and this groomer said, immediately get your dog to the vet. In this episode, as soon as Bondi Vet saw this dog and the bleeding underneath the skin, this could be indicative of something called DIC, which is Disseminated Intravascular Coagulation. And this is a serious medical emergency where the body's natural clotting process goes crazy. And instead of protecting your dog, blood clots start forming all over the body. It blocks blood vessels, and it cuts off blood flow to vital organs like liver and kidneys. He explains in this episode that if that is what this dog has, she could die within literally minutes. So they need to start doing treatment for this ASAP, whether it is that or not. He explained it as an internal hemorrhaging, and she needed immediate fluid and steroids. Once again, I am not a vet. I am going off of Pet MD. knowledge and also Bondi vet episode knowledge and just research that I have done. I will put some extra resource links in the description box below as well. He did fluid, he did steroids right away just to make sure if it was that condition, they treated her right away so she had the best case scenario of making it through. Now, once they got her stable, they noticed that she was improving a little bit. They took her blood and looked at it under a microscope, and he showed the owner how it didn't turn into jelly, which is what they would be looking for if it was the DIC. What they talked about next was the lack of platelets, which in the end, that is what this dog ended up having, and that is exactly what thrombocytopenia is. So once they realized that it was just low platelets, thrombocytopenia, she was sent home with steroid pills to help her body to stop destroying her own platelets. Why I want to talk about DIC first is because this has very similar symptoms to thrombocytopenia, but it is an extreme medical emergency as they are internally bleeding. Anyways, let's get into it. For the DIC, clotting factors within the dog's blood get used up, and your dog may start bleeding from places like the nose, gums, or even show bruising with no clear cause. In terms of what to watch for, symptoms can really vary, so it can be hard to determine what is going on as they can be vague. But some of the most common symptoms include weakness or lethargy, bruising, like we saw in the groin area in both of the dogs, nosebleeds, bleeding gums, blood in urine or vomit, which is, I feel like, very vague. Blood in urine could be a UTI, but who knows? Perhaps it's like a lot of blood. Diarrhea, trouble breathing, abnormal heart rate or rhythm. So a reminder, if your dog or a client's dog is showing any of these signs, this could be a sign of DIC and you need to get them medical care immediately. In terms of how they diagnose DIC, PetMD tells me there is no single test for DIC. Vets will look at blood work, clotting times, and organ function. They'll also search for the underlying cause. So that might involve x-rays, ultrasounds, or other advanced diagnostics. In terms of treatment and prognosis for DIC, treatment focuses on two things. One, stopping the underlying cause because there's always something causing it. And two, providing intense supportive care. So that can look like IV fluids, antibiotics, oxygen therapy, and even blood transfusions. Now, the sad part of DIC is that unfortunately, even with the best immediate care, survival rates hover around only 40%. Dogs that do pull through might have long-term organ damage and need ongoing care. That is my TED Talk about the Disseminated Intravascular Coagulation. Now we are going to talk about thrombocytopenia. So this is when a dog has low number of platelets in its blood. They are essential for blood clotting. They help stop bleeding when a dog gets injured. Without enough platelets, dogs are at risk of spontaneous bruising or uncontrolled bleeding, which is exactly what we saw in Casey. In the Bondi vet episode, they explain even just the clippers going over that area of the dog, and they have these low platelets or DIC going, is enough to cause that spontaneous bleeding in that area. Symptoms of the thrombocytopenia can include unexplained bruising, nosebleeds, blood in the stool or urine, and lethargy. Some dogs might not show any symptoms at all, which is why regular vet checkups are so important. And as you can see, many of these symptoms overlap with DIC. Scary, but important to know. Now, something else to note is that certain breeds like Cavalier King Charles, Spaniels, and Greyhounds are more prone to thrombocytopenia, and it can also be caused by infections, certain medications, or even getting into toxins. When it comes to diagnosing thrombocytopenia, it involves blood tests to check platelet levels. If the count is low, further tests may be needed to determine the underlying cause. In terms of treatment, that depends on the cause as well. It may include medication to boost platelet production, stopping any drugs that could be causing the issue, or addressing underlying infections and conditions. That is all the info I have for you guys today on DIC and thrombocytopenia. Please let me know if you have A, ever experienced this before, B, ever heard of this, and C, just like in any way, shape, or form you relate, or if you have another condition that you want to bring to groomers or owners awareness. Thank you so much for watching. If you did find this helpful, please give me a thumbs up and consider subscribing for more pet related grooming tips, health tips, that sort of thing. I'm trying to get back into a weekly schedule. I would love to hear from you guys down below. And yeah, guys, thank you so much for watching. I appreciate all your love and support, and I will see you guys in the next video. Bye, guys.